welcome you. It's been a long journey, and as you know, nothing good comes easy. It's been rigorous, trying to cross all the T's and dot all the I's with all the relevant regulatory bodies. But I'm glad we are here. I'm proud of what we've achieved so far, but this is just the beginning, really. The vision is to make this place a center of excellence. So there's going to be continuous training, professional development of staff, continuous research, continuous innovation to ensure that the very best is what we provide here. We provide outstanding service. For some of you that have worked with me, in SATMID, I was given the MBT Heroes Award. And that's because of a personal experience I've had. Some of us have had some health challenges personally. And some personal health challenge changed my perspective, changed my view of patients. When I see patients, I don't see them as patients. I see them that it could have been me in their place. So I'm driven by compassion. I'm driven to provide the very best for them. I'm driven to ensure they get the very best healthcare possible. And that's what has been my watchword. That has been the driving force behind my services. And so we've taken time to select our staff to make sure whoever comes on board has the required training, has the required experience, has the required regulatory registration to provide nothing less than outstanding care to our service users. We've also ensured that what we provide here is not just ordinary rehab. So we went to great extent to get this place registered as a community healthcare service provider. So it's not just an ordinary rehab. When we look at service users, we look at them holistically. It's not just come rehab. We want to tailor our services to meet their personal, individualized needs. We've taken our time to provide services like the hyperbaric oxygen therapy. This is something that's not very common in the UK, but is widely used in the US because of the obvious advantages. So, as many of you would know, oxygen is very vital to cell growth, cell health. So, if you see your blood vessel as your garden hose, so garden hose carries water, but your blood vessel carries blood, which carries oxygen to your cells. To buttress the importance of oxygen, I will use a stroke as an example. When people have stroke, what happens is that there's disruption in the blood supply to that part of the brain. And as a result, they don't get oxygen. The brain cells don't get oxygen, and then they have brain cell death, which we want to call an infarct. What oxygen does, it helps regeneration, it helps with healing. And a very important quality many people don't know is that it has a very strong anti-inflammatory property. Most chronic medical conditions are inflammation driven. So oxygen counters that. I'll give you an example. The COVID we had, it wasn't the virus that was killing people. It was what the virus was causing the immune system to produce, what we call cytokines, interleukin-6 particularly, that was causing a lot of inflammation in the lungs, and then with inflammation comes fluids, and people were drowning in their fluid, needing to go to intensive care, to be intubated. And it wasn't until we discovered that actually, when you give something like dexamethasone, it calms that storm. Dexamethasone has strong anti-inflammatory properties. So it calms that storm. People then stopped going to intensive care to be intubated. So oxygen has a strong anti-inflammatory property, and people with long chronic medical conditions like MS, Parkinson's, arthritis, name it, they benefit from oxygen therapy. We just had one patient that just had some brain surgery, had some rehab, came back, didn't quite feel like herself, and she just had one session of the hyperbaric oxygen therapy, and she came back the following day, said she's never felt so well. So it's free for anyone that wants to try it out today. The services today is free. It's the tester day. Just feel free to jump into the hydrotherapy pool if you've come with your swimming suit. Or there's still time for you to go back get your swimming suit. There is aqua aerobics. I think it's 12:20. So there's still time for you to go grab and come, just if you want to use the lawn tennis. So we also understand that it's not just treating people that have had health problems, but it's also prevention is also very important. Prevention is actually better than cure, they say. And health is wealth, as many of us would have heard. And so we also have prevention services available as well. We have obesity treatment, which obesity, as you probably know, is one of the stroke risk factors. So we have treatment for that, and is a package. We also have health and wellness clinics. We have trips and falls, mostly for the elderly. As we get older, our autonomic system gets weaker, and sometimes they just stand up and they just fall. They don't know why they are falling. Sometimes it's because when they stand up, their blood pressure